So why am I taking a couple of days out in October to go to a conference all about guidelines? I mean, do we even really need a conference about guidelines? Aren't they self-explanatory and straightforward? Well, I'm interested in them for a number of different reasons. Firstly, from a clinical point of view, I'm really interested in how guidelines shape our day-to-day practice as clinicians. I'm interested in how they affect patients and how they affect their outcomes. I'm interested in whether they're written for the patients themselves or are they written for clinicians. And I'm interested in whether they are actually a guide or are they a rule to follow or are they a tool? And are they aligned? So are they linear in nature or are they much more complex than that in reality? From a management point of view, I'm really interested, having spent more and more time in management, about how guidelines affect teams and services. Do they encourage good working cultures or do they encourage micromanagement and mindless rule following? And from a science point of view, I'm interested in what kind of data is useful for guidelines and what data might not be so useful for guidelines. What type of evidence is the best type of evidence to use for kind of getting the guidelines together. And from a philosophy point of view, I'm really interested in why guidelines are there in the first place, where have they come from, what role are they fulfilling. I'm interested about what kind of things get included within the guidelines, but I'm much more interested as well about what gets excluded, what falls outside of the guidelines. So things like placebo or therapeutic alliance are traditionally difficult to fit inside a guideline. So I'm interested in lots and lots of different questions about the guidelines, and I hope that some of this will be explored by the many great speakers at the CauseHealth event in October. But probably the main reason I'm going to the CauseHealth conference is to have a beer and a curry. Cheers.